Hello, welcome back. Today we're looking at a very important topic, which is the radial nerve. My aim in this video is to teach you how to write ACS anatomy, and today our focus will be on the radial nerve. If you have been watching my videos, you will know that there's a mnemonic that helps us to form an outline for structures that we consider as transit structures. That is structure that originates from one point and terminates at another point. And the radial nerve is a transit structure because that's an origin and a termination. And this mnemonic is: I only carry strong books regularly calmly. I for introduction, O for origin, C for cause, S for structure, B for branches, R for relations, C for clinical correlation and conclusions. Now, as introduction, the radial nerve is a major nerve of the upper limb. It provides both innervation to the extensor muscles of the arm and the forearm, and sensory innervation to the posterior arm, forearm, and part of the hand. Now, the radial nerve originates from the posterior cord of brachial plexus and carries contribution from the spinal root of C5, C6, C7, C8, and T1. So the spinal root of the radial nerve is C5 to T1. Now, this is a structure showing the posterior cord and the radial nerve originating from the posterior cord of the brachial plexus. The course of the radial nerve is as follows. In axilla, it runs posterior to the axillary artery. You take note of this because the radial nerve is a branch of the posterior cord. That can help you remember that the radial nerve in the axilla is posterior to the axillary artery, and it gives branches to the long head of the triceps brachii. Then it travels along the radial groove of the humerus and supplies the triceps. It pierces the lateral intermuscular septum and enters the anterior compartment. In the anterior compartment, it passes anterior to the lateral epicondyle. Now, in the forearm, it divides into superficial branches that give sensory to the lateral forearm. It gives sensory innervation to the lateral forearm, and it also divides into a deep branch, which is also called a posterior interosseous nerve, that gives motor innervation to the extensor muscles of the forearm. Then it also provides sensory innervation to the dorsum of the lateral hand, excluding the fingertips. You will see more of this as progress in this video. Now, this is the course of the radial nerve demonstrated in this picture, and we can see the radial nerve in the radial groove, and this is the deep branch of the radial nerve. Now, this is a mnemonic that can help you remember the course of the radial nerve if you want to write on the course of the radial nerve, and this mnemonic is last. A for the axilla. Remember, radial nerve is a branch of the posterior cord of the brachial plexus, so it will run posterior behind the axilla. It is posterior to the axillary artery. So, about the origin can help you remember that the radial nerve is posterior to the axillary artery. Then R is radial groove. The radial groove spirals around the humerus in the mid shaft. So this is where the radial group is located in the mid shaft. Then it's between the lateral and the medial head of the triceps. Now it pierces last. Look for lateral intermuscular septum. It pierces the lateral intermuscular septum to enter the anterior compartment. This is very important because the ulnar nerve pierces the medial intermuscular septum. Also, with the mnemonic last, you can remember that the radial nerve pierces the lateral intermuscular septum, not the medial intermuscular septum. Therefore, A, it is anterior to the lateral epicondyle. Then it enters the forearm through the cubical fossa, where it divides into deep and superficial branches. Then the superficial branches or the superficial branch give sensory to the lateral forearm and to the dorsum of the hand, while the terminal branch, which is the posterior interosseous nerve, give motor supply to the extensor muscles of the forearm. Now, the structure of the radial nerve. In this point, it is very important that you sketch a structure, a diagram of the radial nerve. Whenever you see structure, what I expect to do at that point is to draw about what you have been asked to write about. If you have to write about the radial nerve, try and draw a sketch a structure about the radial nerve. It will give you 3 points in your exam. Now, the radial nerve's motor supply controls the extensor muscles of the arm, the forearm, the wrist, and the fingers. And the sensory supply is that it provides cutaneous sensation to the posterior arm, forearm, and lateral dorsum of the hand. Now, for branches, in the axilla, it gives branches to the long head of the triceps brachii. In the arm, it gives muscular branch to the triceps, to the anconus, and the brachioradialis. And it also gives a posterior cutaneous nerve of the arm. Then in the forearm, it divides into superficial that provide cutaneous innervation to the dorsum of the hand, and also a deep branch that provides motor supply to the extensor muscles of the hand. Now this is a diagram showing the branches, the supplies of the radial nerve from the axilla to the radial sulci, to the radial groove, to the lower lateral side of the arm, to deep branches and superficial branches. Now this is also a diagram showing the supply of the radial nerve. We can see the lower lateral cutaneous nerve of the arm, the posterior cutaneous nerve of the arm, the posterior cutaneous of the forearm, the superficial branches supplying the dorsum of the hand, and also you should also take note that the radial nerve also supply the anatomical nerve bus. Now for relation, proximally it lies posterior to the axilla and the brachial artery. You should take note of this, that the radial nerve is posterior to the axilla and the brachial arteries. In the mid-arm, it travels along the radial groove of the humerus, and this is the most vulnerable point because any fracture at this point can affect the radial nerve. Then distally, it crosses the anterior to the lateral epicondyle. Now for clinical correlation, we should take note of certain clinical correlation, which is the radial nerve palsy. Radial nerve palsy can be divided into three. We have the high legion, the mid-arm legion, and the low legion. The high legion are the legion that is seen in the axilla and the spiral groove, and this high legion can lead to wrist drop, loss of elbow, wrist and finger extension, and sensory loss. Now, mid-arm too causes wrist drop, which affect the extensor muscles, but a low legion just causes weakness in the finger, in extension, but preserve wrist extension because the muscles is not affected. Okay, this is wrist drop, and in the case of wrist drop, there is a radial nerve palsy, and that is arising from either the axillar part, which is the higher region, or the mid-arm region. Any injury around this region can cause wrist drop, and in wrist drop, there is an unopposed action to the flexor muscle because of the weakness of the extensor muscles, and this leads to unopposed action of the flexor muscles, causing wrist drop. Now for Saturday night palsy, we should also know that compression of the radial nerve in the axilla can lead to temporal weakness and sensation. In this case, there's no damage to the radial nerve. There is just a compression, prolonged pressure on the radial nerve, and it can lead to weakness and sensory loss of the area that is supplied by the radial nerve. We also have what we call the radial tunnel syndrome, and the radial tunnel syndrome is compression of the posterior interosseous nerve causing pain and weakness in the wrist and finger extension. And this is the posterior interosseous nerve, which is the radial nerve. And when there's compression, because the radial nerve passes between the supinator muscles, when there's compression between the posterior interosseous nerve, it can cause radial nerve palsy. Now the next is conclusion. In conclusion, the radial nerve is the vital nerve of the upper limb, providing motor innervation to the extensor muscles and sensory innervation to the posterior upper arm and lateral hand. Understanding its cause, the branches, and clinical significance is crucial for diagnosing and managing nerve injuries. So if this mnemonic have been very helpful, I only carry strong book regularly, and the other mnemonics in this video, if it's going to be helpful for you to write essay on the radial nerve comfortably, please, I want you to like this video, I want you to subscribe and share. Thank you for watching.